Dr. Omar Abdel-Mannan is a paediatric neurologist. He joins me now live from our studio. Normally, a birth like that, miraculous in the best of times. In this situation, clearly one that is going to pull at the heartstrings. What do you make of that? How worried would you be about that situation, about the prospect of these kids not being able to get anything close to the sort of care that they will definitively need?
Sure. So, John, I think, having worked in large tertiary neonatal hospitals and neonatal units in London, I can tell you that the birth of quadruplets is almost, I've come across one of those births in 10 years of working as a doctor in London. And when that happened, we had a whole team ready, and that included the consultant, the junior doctors, the obstetricians, lots of medications, equipment ready to intubate any one of these babies, because you can imagine 4 babies coming out one after the other. There is a high risk of some sort of morbidity, some sort of complications in that situation. So it is frankly a miracle that this woman has given birth and these children have survived. But the reality is that this is what is happening in Gaza. And I'm speaking to, and we are speaking as a team, to doctors on the ground, maternity, obstetricians, who are telling us that women are giving birth in camps, in shelters, on the street, in destroyed, in the rubbles of their homes, because in the north of Gaza, there are no maternity services available to, hundreds of thousands of people. So imagine being in London, and giving birth in North London and saying, sorry, there's no hospital care, available for you. There is no midwives. There is no equipment. There are no medications to treat you when you have a postpartum hemorrhage and you bleed out, which often happens in these situations. So that is the reality for women day in, day out. And we have to remember that in the last 2 months, 10,000 women have delivered babies in that space of time. That is a humongous volume on any healthcare system, let alone one that has been decimated and completely destroyed.
As someone who's worked with people that have gone through similar things to this, perhaps not on the scale of 4, can you give us a sense of what the normal emotions might be and how that is going to be exacerbated by a situation which this lady is now faced with, presumably worrying that her kids may not survive much longer?
So the emotions run extremely high in any multiple birth scenario, to twins, triplets, quadruplets. There is always concern about the health of the babies and the fact that one may survive, one may not. So there's a mixed emotion. So people are obviously joyous that this is a time of delivery, this is giving life, essentially. But there's also the dark side, which is a risk of any of these babies coming in extremis and being unwell. So that reality in Gaza is compounded by the fact that these women are basically, in essence, the hospitals they were giving birth in are being targeted and destroyed. And they are having to do this in extremely dire situations. It is the closest thing I can think of is, in the bushes of Africa, women giving birth literally in these sort of conditions. And that is what this, frankly, psychopathic state has basically, led Gazans to live in these conditions, because they have decimated the whole population. They have bombed hospitals. They have got rid of maternity services and pediatric services. We have to remember these babies, when they're born, who looks after them? It's the pediatricians. The pediatricians are either being killed or targeted or illegally detained and abducted by the Israeli occupation forces. So that is the reality for Gazan doctors day in, day out.
Can you tell us how complicated is it to run these sorts of establishments, these sorts of pediatric operations, and to run the departments more generally? And how difficult is it going to be to re-establish those in Gaza if perhaps this conflict finally comes to some sort of cessation?
So a neonatal unit, for example, in London, you have multiple levels. So you have a basic neonatal unit, a secondary and a tertiary level, and that basically looks after different cases. So triplets or quadruplets would need to, in London, be born into a tertiary, the highest level of neonatal care. This is run by sisters, nursing staff, NICU nursing staff, pediatricians of the highest quality, of which there are many in Gaza. But the reality is now we saw babies being taken out of incubators because there's no oxygen being delivered to them, and there was no supplies because of the generators running down. So the reality is these babies that would have survived with the right equipment and the right resources are unfortunately dying in droves. And we have seen this. We saw it in Al Shifa hospital. Many of the intensive care patients were died, and many at our Ahli hospital were left to rot. And we saw those pictures on our TV screens. And it is horrific as a father, as a pediatrician, as a doctor, as a human being to see this happening.
Yes, the pictures in general are horrific every day, and certainly that's something that I think will stay with all of us after this. Thank you so much for that, Dr. Omar Abdel-Mannan, who's a paediatric neurologist. Many thanks.